Hi, this is Dr. Farley. I want to go over with you in this video about what are the chief symptoms, complaints of neuroinflammation, and how would you know that you have this problem? Again, symptoms are never accurate because you could have it and not necessarily have these symptoms. But in general, if you do have some of these symptoms, it'll give you a key into that you likely have this neuroinflammatory process taking place. If this is not addressed, you are over time creating major increased risk of neurodegeneration. And under neurodegeneration, we also see neuropsychiatric symptoms. So some of the things that people will complain of could be brain fog. You start complaining of brain fog. My brain doesn't work so well. Inability to focus, concentration. My memory is dropping down a little bit. I hear he, oh, CR. I forget the mnemonic, but it's something about I just can't remember anything. And as people start getting into their 40s and 50s, they make jokes that I don't know where my phone is, and I made the wrong turn, and I don't know where my keys are, and I went into the room. These are signs that you have a neuroinflammatory process taking place and that you are starting to show signs of neurodegeneration. And you have a major increased risk of Parkinson's, Alzheimer's, multiple sclerosis, Lou Gehrig's disease, and also neuropsychiatric issues like depression, anxiety, bipolar, even schizophrenia. So, more symptoms: poor memory recall, inability to handle stimulation, crowded environments, loud noises. I remember my mother used to have this, and I didn't even understand it back then, which is about 20 years ago. But she would easily get overwhelmed, overloaded with crowded environments and loud noises. A need for excessive sleep, fatigue, and fatigue can be a few things. There can be body fatigue and then there can be brain fatigue. Brain fatigue means if you ask me questions, if I'm trying to do homework, I get tired. If I drive in the car, I get tired. If I try to read, I get tired. If you ask me to focus, I can get tired. And then poor endurance with brain activities. Again, using your brain, you can feel really tired and fatigued. Some diagnosed conditions that the person may have are depression, anxiety, bipolar, schizophrenia, schizoaffect disease. I recently just had a patient of mine go into a psychiatric hospital. She was doing wonderful. And I had a conversation with the psychiatrist. And after I talked to him for a few minutes, he just said to me, "Wow, all my patients need to get an evaluation from you because this is groundbreaking what you just said to me." And again, most of those people are being told that they've got genetic problems and there's neurotransmitter imbalances, and this is a very unscientific way to approach these problems. Chronic fatigue syndrome, another one. Chronic fatigue, I just can't get out of bed, I'm exhausted. It's a big one, and it usually is a sign of neuroinflammation. Post-traumatic stress syndrome. How about this? How about the person's not broken, but they had a excessive stress response, and now their neuroinflammatory response, due to that and many other factors, is stuck in a loop, and they get this PTSD type symptoms, and they will again be told that it's from the event, whether that's war or a sexual assault, whatever it may be, and they think that they're kind of broke and stuck like this forever, when realistically we can go in and try to modulate this and change these neuroinflammatory process. Post-concussion syndrome. You hit your head, your child hit your head, you better address this neuroinflammatory process. If not, you are going to change your microglial cells from little poodles into rabid pit bulls, and they can over time destroy the brain. Your child or you or anyone has hit their head, has had a car accident, especially has lost consciousness, you better get a practitioner like myself to address this and get on this ASAP. Because if not, you're going to increase the risk of future neurodegenerative diseases and future neuropsychiatric diseases. Again, depression, anxiety, bipolar, schizophrenia. Chronic pain syndromes. I've seen certain patients that no matter what I do, no matter what magic I do on that area of the body, I can't get it to change until I address the neuroinflammatory component. And then magically, guess what? My knees feel better, doc. And my hands feel better. And the pain I had in my shoulder went away. Don't forget that the nervous system is the master system. And when that system is stuck in a neuroinflammatory process, and which also over time may lead to a neuroautoimmune process, you need to address this. Otherwise, you may get weird symptoms throughout the body, and it's coming from the neuroinflammatory brain problem. Fibromyalgia is another good example of that. It's a wastebasket term for we have no idea really what's going on with you, but you can't even touch the person. It's not a body problem. It's a brain problem. Stroke, you have any kind of history of stroke or even TIAs, then you definitely have neuroinflammation taking place. And then lastly are the neurodegenerative diseases, dementia, Parkinson's, MS, Lou Gehrig's disease, tics, ADHD, Asperger's. All of these patients have a neuroinflammatory process that needs to be addressed. Otherwise, over time, the brain continues to get worse and worse and worse. Their symptoms get worse and worse and worse, and then they have a major increased risk of future worsening of the neurodegenerative diseases and future worsening of these neuropsychiatric symptoms. And overall, the entire person's health will go down because the master nervous system is breaking down from the neuroinflammatory process, and the rest of your subsystems just simply follow. If the brain drops in function, your health goes down, period. If the brain goes up in function, your health goes up, period. Hope you found this interesting. Any questions, please let me know. Thanks.